What are you concerned about in this fourth wave?
What I'm concerned about is those certain states that have not enough of their high-risk population vaccinated, putting their hospitals into crisis. Right now, I think it's about 8 states or so constitute about 51% of all COVID hospitalizations. So what we have is a regional problem, and those hospitals are under stress in those states in the South where they're getting inundated with totally preventable COVID-19 cases.
I looked at the University of Mississippi Health Center. There's a critical care unit. You go across a little bridge and there's parking garage B. I believe they have 2 tents now in parking garage B, just like Mount Sinai had tents in Central Park long ago and far away. Who has the power to tell Mississippi to do this, to stop that?
It's very difficult. I don't think anybody has the power because now it's up to the individual citizens of Mississippi to do the right thing and get vaccinated and not put their own local hospitals into crisis. It's actually all, like I said, self-inflicted and completely preventable. If people in Mississippi, those high-risk people that are getting hospitalized, if they were vaccinated, we wouldn't have people getting treated in parking garages. We wouldn't have people being transferred out of state from Mississippi to other states. We wouldn't have COVID-19 being a problem in certain regions of this in the United States. We would be more decoupled the way it is, for example, in New York or Pennsylvania, where we've got cases, we've got hospitalizations, but we're nowhere near crisis because so many high-risk people have been vaccinated.
Dr. Adalja, what's the latest in terms of infection rates for vaccinated individuals?
So it looks like breakthrough infections had been rarer with some of the other variants. With the Delta variant, it seems to be something that's picking up. It's still not a common problem. It's probably 1% or around there, depending upon who's getting tested. But what we do know about the infection rates in fully vaccinated individuals are that if you get a breakthrough infection, it's likely not to be a major issue. It's not going to be clinically significant. It is extremely rare to need to be hospitalized, and it's even more rare to die from this. So the vaccines are holding up when it comes to what matters with breakthrough infections, preventing serious disease, hospitalization, and death. And if you go through the hospital, the majority of people are not vaccinated that are getting admitted for COVID-19.
I understand that from a sort of public health perspective. However, from a transmission perspective, this really sets the community back. If vaccinated individuals can be infected, then can pass along those infections, how much does the Delta variant accelerate the need for a booster shot, for that third shot 8 months after the first doses have been completed of the mRNA vaccines?
So this is a little bit unclear because if you're talking about preventing mild breakthrough infections in vaccinated individuals, I don't think that's the real threshold for needing a booster. To me, the threshold for needing a booster is to see breakthrough infections landing people in the hospital at a serious rate, and that's just not happening. I think it's important to study boosters in healthy populations and have a plan ready to go if that's necessary. And there indeed are some rumors that maybe in September, healthcare workers and those people that were vaccinated early on, like myself, I was vaccinated in December, might get a booster. But I don't know what impact it's going to have on hospitalizations to give third doses to people when you're talking about people who haven't gotten first doses. I think it's more important to get first doses in people in Mississippi than get third doses in people from Pennsylvania.
What's your pro take on schools? I mean, I understand there's a partition at age 12 as well, but what's just your sense here into August and into the first 2 weeks of September?
Schools are going to be a victim to what's going on in the community. So if you have an outbreak uncontrolled in the community, you're going to see cases in schools. The best way for schools to stay open, and I think that has to be a priority, in-person schooling, is to have as highly vaccinated a student body and a teacher body as possible. And I think it's good that the teachers' unions are talking about vaccine mandates as a condition of employment. You also have to remember that if you have children that are less than 12 that are unvaccinated, you're going to need school district flexibility on masks and how they do things, especially with certain activities, particularly extracurricular activities where it's harder to social distance, where we saw cases occur. Sitting in class at a desk is probably unlikely to be driving spread. It's all the other stuff that drives spread. So there, I think we're going to have to look at it on a community by community basis. School districts are going to need to be very specific based on rates of transmission in their community, rates of vaccination in their community, and rates of vaccination in their schools.